There's a lot happening with New Jersey's child welfare system. We want to help you make sense of it and share our story. This is DCF on the Air.
This is DCF on the Air, and I'm Jason Bukowski. Thank you for joining us as we discuss the transformation of child welfare in New Jersey with some of the leaders who are making it happen. In child welfare systems across the country, there's a revolution taking hold. We're transforming our thinking and our focus away from reactive and potentially punitive child protective services to more upstream, proactive prevention strategies to head off abuse and neglect before the family experiences those destabilizing forces which can contribute to a higher likelihood for child maltreatment. We're recognizing that the social determinants of health and well-being, issues like the availability of affordable quality housing, access to nutritious food or a good education, economic stability, affordable and reliable transportation, issues of community violence or substance use, all of these play a part in the outcomes experienced by families, whether they're involved with the child welfare system or not. It's all connected. And if we're going to make a difference in the lives of families, if we're going to give them the tools that they need to be successful, we need evidence-based and evidence-supported practices that strengthen and elevate the family, that allow them to reach and maintain their nurturing and protective potential. In February 2018, the federal government passed the Family First Prevention Services Act, legislation to begin to shift the priorities of child welfare systems towards prevention by changing some of the calculus around how federal funding is allocated. For the first time, systems could draw down matching federal funds to stretch their own investment in evidence-based prevention strategies. Under the Family First Act, states now have the flexibility, support, and resources to begin to explore how we pivot our systems around the protective factors framework to create the conditions within families to lower the risk of child maltreatment. Many states have begun to take advantage of this new federal law to bolster prevention efforts within their borders. But in New Jersey, even prior to the Family First Act, we already had a robust prevention services portfolio. Recently, New Jersey finalized a 5-year prevention services plan to submit to the federal government under the Family First Act. And today we'll be talking with one of our system leaders who has been instrumental in organizing our prevention strategies and services. New Jersey DCF First Deputy Commissioner Katherine Stoehr joined the department in 2018 at the start of the Murphy administration. She's previously worked in the New York City's Administration for Children's Services and the Office of Children, Youth, and Families in Allegheny County. Katie brings a visionary's perspective to the child welfare space, and we're lucky to have her in a leadership role here in New Jersey. Katie, thank you so much for joining us here on DCF on the Air.
Thank you.
I want to begin by framing the Family First Act for our listeners who might not be familiar. What is the Family First Act, and how exactly does this law change the way that the federal government supports the provision of child welfare in jurisdictions like New Jersey?
Great question. So the Family First Act is really a landmark piece of federal legislation in the child welfare space. I think it's easily the most important piece of federal legislation in child welfare in at least the last 20 years. Why is it that big of a deal? Because it establishes for the first time a means through which federal dollars can flow into preventing foster care placement and preventing abuse and neglect in a much more robust fashion than was in place in the past. So that's one thing, the financing. The second is that when you read the act and what it's saying about the goals of the child welfare system, it is establishing a mandate for jurisdictions across the country to do everything that we can to keep families together safely and reserve foster care placement for those rare situations when that can't be done. And so it's changing the framework. It looks to change the framework, I think, or it has that effect for systems around the country. On a more technical level, what it does is it removes federal financial support for most forms of congregate care placement. So it says, look, states, if you want to place kids in group homes, that's on your dime. We, the federal government, will help you access treatment services for kids. And if there's a situation in which a young person needs the kind of treatment that requires 24/7 supervision in a facility, that can be federally reimbursed. But just a group home, not anymore. So that says that. And then it establishes this infrastructure, this architecture for federal claiming on the prevention side. So I'll go into that for a moment. What it offers to states is to say, we, the federal government, will reimburse a portion of every dollar you spend on certain kinds of prevention services. So it's not wide open. It has to meet the criteria. And the criteria are, it's stood up in three types of prevention services. So it's mental health treatment, it's treatment for substance use disorders, and it's parenting education. So the service has to be in one of those three domains. And it has to be evidence-based, and there are criteria in the law for what that means, ranging from pretrial to post-trial, all the way through random control trials and peer-reviewed publications. So it's not evidence-based because I say so, or because there's a satisfaction survey attached to it. They're looking for published literature, third-party studies, that kind of thing. It has to, that the model has to exist on a federally approved clearinghouse of models that are it's called the Family First Clearinghouse. So the type of program that a state wants to provide needs to be approved by the federal government in that clearinghouse. So once those three things are met, it's in one of the right categories, the evidence base has been reviewed and accepted, and the model is accepted into the clearinghouse. If a jurisdiction stands up that service, then there's a way to claim back a portion of every dollar spent on that service through federal dollars. States can then use those dollars to fund, more prevention work, ideally to keep kids and families together, keep families strong, and start to reduce the need for not only foster care placement, but also child welfare involvement generally.
Yeah. When I think about it, it's almost like the federal law embodies so many of the different facets of transformation that we think about when we think about child welfare. So it's elevating mental health, it's supporting parents because they're the support to the child, rather than only focusing on child protection in isolation of any other aspect of protection.
Yeah, I mean, prior to the passage of this act, this is an amendment, by the way, to Title 4E of the Social Security Act. That's where it sits in the federal statute. Prior to the Family First Act, Title 4E funding was only available when you placed a child into foster care. That's the moment at which a state could start to ask for money on the dollar from the federal government. So that was flawed. Everything we know about good practice says try to prevent the placement of children into foster care when you can do that safely, because just the act of separating children from their families, notwithstanding any other circumstance, even if there is maltreatment in the home, just that act of separating a child from everything that's familiar to them has lifelong consequences for that child and for their caregivers too.
Yeah.
Sometimes it needs to happen, but we would like for it not to, for all those reasons, right? So we all know that as a field, and yet the federal financing structure had not caught up to that knowledge. What the title, and then if you look at the rules, some of the language in the rules of the 4E, the traditional Title 4E expenditures, it will permit you as a state to claim federal financial participation for the care and maintenance of children in foster care. That sounds like a car.
Yeah.
So what we were able to claim financial participation for was sort of like 3 hots and a cot and some social services for the child. But efforts to help the parent were not claimable. So again, this dichotomy around everything we know about the science and social science in the last 20, 30 years was out of step with the financing mechanism, which was really of another era. I'll put it that way. It was definitely of another era and badly in need of reform. And it took a long time and a lot of people's efforts to get this reform through Congress. We're really grateful that happened, and I think every jurisdiction wants to take advantage of this new opportunity, and we're all figuring out how to do that in ways that best fit our states.
Yeah. Now, I know New Jersey had previously only been using congregate care for treatment and therapeutic supports for the most part. And we also had sort of an existing, and I said it at the top of the episode, an existing robust prevention infrastructure here in New Jersey, even prior to the initiation of the Family First Act. Um, can you talk a little bit about what prevention programs are available here in New Jersey and what kind of difference are they making in the lives of families?
Yeah, New Jersey is not the only state, but in not a large group of states that have for some time made large investments in prevention services. So the shape that that has taken here in New Jersey is, I would say, a couple different things.
Mm.
We can think about a group of programs that are funded in communities to prevent maltreatment from happening in the first place, and to do that through helping families to be stronger and helping them to connect to needed resources when they struggle before anything escalates into something that's more risky. So in that category, we can think of our network of family success centers. We have 57 of them located throughout the state. These are kind of one-stop shopping type of a situation for families who need to connect with each other, who need to know where to go to find help in their community, who can access help in that family success center. They're kind of governed by a group of community members and parents who help to shape the programming that is delivered there. So each one looks really different because the communities that they're in look really different. You might be able to get ESL classes at one center, you might be able to get parenting supports at another. There might be a diaper bank operating out of one. So those are really, you know, deeply community rooted ways to help make sure that families are not isolated, that
Mhm.
families can connect to help when they need that kind of help, that sort of thing. We also have a statewide network of 3 evidence-based home visiting programs in all 21 counties of the state that's been in place for well over a decade. We run that network in collaboration with the New Jersey Department of Health.
Mhm.
So those are 2 that I would highlight that are well outside the child welfare system. Um, and then in the treatment zone, we talked a moment ago about the children's system of care, although we didn't name it,
Yeah.
but the the robust children's system of care that New Jersey has really is pretty unique in the country. Why is it unique in terms of child welfare is that in some other parts of the country, in order for families to access higher end treatment services for their child, in some parts of the country, that parent would have to relinquish custody of their child, place their child voluntarily into the child welfare system, and because that's the only place where the higher end treatment capacity exists. Fortunately, in New Jersey, that's not the way we operate. We have built that whole treatment network of pushing treatment into homes, or if out of home treatment is necessary, in a residential treatment facility, for example. That all is accessible to any child in New Jersey without respect to insurance type or anything like that, and critically doesn't require child welfare involvement with the child protection system to get into that treatment network. So that is another form of prevention because we're making available all the clinical supports to families that may need that without requiring them to walk through a child protection door.
Yeah.
And then the third category I would name is programming that's available to families who have been part of a child protection investigation, and there's some stuff going on that's hard in that family. They're really
Sure.
struggling. um, what are the services that can be provided to that kind of a family to prevent? In this case, it's not preventing the need for a call to the child abuse hotline or the need for an investigation that has happened, but what can we do to prevent then foster care placement?
Mm.
And New Jersey has made some long investments there too that are really working well. So we have a statewide network of what we call family preservation services. This is kind of the um, not the last stop, and it's not the best way to say that, but an intensive service that can be attached to families to prevent the need for foster care placement when that's looking like it may need to happen. Right.
Mm.
So it's we're going to try this and see if it can work. Really intensive support for families. We have a Keeping Families Together supportive housing program. That's a housing first model that will work with families who have lots of complexities in their lives, homelessness, in addition to maybe parental substance use disorder or domestic violence or other challenges that they're facing, and try to just wrap ourselves around that family, provide the housing, get everybody stable, and then work through the clinical issues that may need attention. So I think all of these investments are investments New Jersey can be proud of, and they're working. We have the lowest foster care placement rate in the United States, and that's a really great thing for our state. It means that we're not having to take this really drastic step of separating children from their families unless we absolutely have to do that in order to keep children safe. And it's that has long-term consequences for everyone in that family.
Sure.
So we're doing everything we can to make sure that that step of family separation is reserved for very rare situations.
Yeah, I think when you start to think about some of the statistics within our system, um, I think you definitely see how our prevention strategies are playing out and how they're improving outcomes. So you said New Jersey has the lowest rate of out-of-home placements. I think it's under 3,000 children in out-of-home placement right now.
Right.
At the start of our reform effort in 2003, it was 13,000 in out-of-home placement. If you look at the number of substantiated or established allegations of child abuse, I think we were just over 9,000 in 2015. We're under 3,000 there as well now, as of 2022. So I think you are definitely seeing how the prevention strategies are playing out in the lives of families. But I'm wondering, because you do have experience outside of New Jersey, and we've both been a part of the New Jersey system, I think, for the last 5 years. But with your previous experience and with your connections on the national level, how is New Jersey viewed sort of in this prevention space by other jurisdictions?
Yeah, I think New Jersey is well known for our children's system of care, and I think we're well known for reserving foster care placement for only rare circumstances when it's needed. Um, I think that the other thing that I would say around this is that these practices like the children's system of care or our Keeping Families Together program or the Family Preservation Services, and the ones that are further upstream, like the Home Visiting Network, for which we're also nationally known, those don't exist and they don't act alone. They don't act in isolation. There are a lot of other public policies that affect children and families in New Jersey that I think matter a lot for the way in which we see the statistics that you just mentioned changing over time. So, for example, we are moving towards a $15 minimum wage. We have had bail reform. If you think about what are the public systems that separate parents and their children from each other most frequently, it's not child protection. It's the criminal justice system. Bail reform is a really big deal.
Yeah.
And I think that I'm just calling out a couple of examples here. There are a myriad of others, and we really went out of our way to try to describe in our federal 5-year prevention plan all of these other policies. TANF, we now have a minimum SNAP benefit in New Jersey, the $15 minimum wage, the bail reform, and a myriad of others that are in the environment that we operate within as a child protection system, and that do a lot to keep families strong so that they never even come to the attention of the child protection system. So that's what's, I think, also unique about New Jersey is that there's a lot of kind of rowing together to try to build this infrastructure that keeps children safe, keeps children healthy, keeps them well, and keeps them together with their families so they can all succeed as a unit.
I think to that point, I remember reading a study in 2017 where it showed that for every dollar raised in the minimum wage, there was a 10% reduction in allegations of neglect.
Yeah.
So I think that really does showcase that it's not just about the child welfare system. It's all of the policies in place within a jurisdiction to support families across the spectrum of need that really play into reducing child abuse and neglect across the board.
Yeah, and there are an increasing volume of those kinds of studies that look at the correlation between changes in social welfare policy more broadly, and social service maybe policy more broadly, and an economic policy, and child maltreatment and foster care placement. So that academic work to demonstrate how those are linked phenomena is maturing rapidly. There are studies that look at the link between, for example, in the mortgage crisis in 2008 and the housing instability that happened then, and increases in rates of child protection involvement for families, or even injury to children. So housing instability that's a very big deal.
Mm.
Increasingly, there's examinations of cash assistance policies and so on. The National Academy of Sciences put out, I think in 2018 or 19, a roadmap to decreasing child poverty or even eliminating it.
Mm.
And there's been some work by Chapin Hall and some others to look at what about those policies and their impact on child maltreatment rates. So that's a very exciting field of study. I think it's doing a lot of work to validate what any of us who work in this field know to be true, but to have it demonstrated in academically rigorous ways I'm very hopeful about that moving the needle nationally as well.
Sure. Yeah, and I think it's, like you said, very validating to, this is sort of what we knew anecdotally on the ground, and now we're hearing about it academically. It's validating what we already knew. I want to ask a little bit about, the Family First Act has been around since 2018, but New Jersey only just recently submitted our Family First Prevention Services Plan. And I'm wondering why there was that, delay when we already had the services on the ground.
Yeah, I think there's a couple factors there. One thing that was true for everybody, for all of the jurisdictions, was the law was passed, but then there were a lot of rules that needed to be made at the federal level to govern exactly what kind of expenditures would be eligible, different processes needed to be defined, all of that. And that took maybe a year and a change for the federal government to issue all of the procedures and the bulletins and things that they needed to do. So that was kind of the first piece. And then establishing it's called the Federal First Clearinghouse. That's the group of programs for which a state is eligible to ask for federal financial participation.
Sure.
Maybe I'll explain that a little bit further in a moment. But that clearinghouse has taken a lot of time to establish as well. It involves folks reviewing the academic literature pretty rigorously and looking at the extent to which, for each program named, the evidence base fits into one of the three federally defined categories: well-supported, promising, supported, and establishing those ratings and then publishing them. So that takes time to comb through all of that literature and look at the extent to which the standards have been met. The other things that were true in New Jersey, though, if you look at a calendar, is the policies were becoming more clear federally in kind of early to mid 2019, and we were planning in earnest for the next 6-8 months. During that time, one of the things that we realized we needed to do in order to be able to do the mechanics of claiming, we needed to have an information technology and information management strategy in place for this department, because this was going to require data collection and data processing of data related to programs that are managed by networks of providers, not directly by the department. And that's a newer space for our IT development. So we realized that, and we were working on figuring out what to do then. And then COVID happened, and it happened earlier in New Jersey than it did in most parts of the country. And it was quite protracted here. And so we needed to stop planning around this for a bit and attend to the health emergency that was in front of us and that was impacting our staff and ourselves and the families that we serve, all of our constituents. And so coming out of COVID, we were in a different landscape than we were when we entered it. And so we had to adjust our thinking, accordingly, and pull together the plan. But I think critically, I will also say, because of all of the investments New Jersey has made for 1-2 decades or more in prevention that we spoke about earlier, there was less opportunity in some ways for us to take advantage of these new federal dollars, because you can't double dip. So the home visiting programs that I mentioned earlier, 3 evidence-based programs in all 21 counties, already have federal financing attached to them. There's no incentive to take it off of the funding that it's already attached to and now attach it to Title IV-E. Similarly with the children's system of care, that's all on the Medicaid platform. It would not make a lot of sense to detach it from the Medicaid platform and attach it to IV-E dollars through Family First. Why would we do that?
Exactly, yeah.
Other jurisdictions who have not historically had the depth and the breadth of investment in prevention services that we have had in New Jersey have a little bit more of a green field, to work in.
Yeah.
We have we have to have a trickier approach here to find the places where there's not already federal match happening or it's not already resting on a federal grant or something, to look for ways to infuse new federal funding into those spaces, shore them up. So that's a longer exercise.
So I know that we weren't the first to go with Family First Act. Did we draw any benefit to kind of going later, that we could see how other applications were being accepted, or maybe that there was some pushback from the federal government, or was it, did we derive any benefit, I guess is the question.
I think I'll say a couple of things there. So one is we weren't the first to go on our prevention plan, but there are many components to the Family First Act. And so we have been doing the work to bring our family foster care regulations into conformity with federal requirements. We looked at our congregate care work. We did not have we don't have the same starting place here in New Jersey that other jurisdictions have. We make pretty rare use of congregate care placements, and we already have the framework of making sure that those are used rarely and for treatment purposes if they're used through the children's system of care. So we didn't have as much changing to do as other states in that regard. Yeah. But in terms of the prevention plan, there are benefits to going first and there are benefits to going at the end, So we are in dialogue, in national dialogues that look at what each jurisdiction is planning around and what they're looking to include, what looks like it's off the table as the federal government has developed its more nuanced, position on any of the questions that might come up. And I think there's a faster, maybe a more defined process of approval at this point than there was at the very beginning. So I think that's good news too. Some of the policy questions that have come up have been settled at this point, and so it's not so much, necessity for back and forth between the feds and the states.
I know that this theme has come up several times through this podcast, and we designed this podcast around telling the story of the child welfare system here in New Jersey. And we know that narratives matter. When we talk about child maltreatment prevention, it's about engaging families before there's child abuse or neglect. But I'm wondering if there's any challenges that systems are experiencing as a result of sort of the narrative of getting involved in child welfare. It comes to mind that, there is this stigma attached to being involved with the child welfare system. And as a result, I'm wondering if some of these upstream prevention strategies, if we do run into that stigma when we're trying to engage families, is there a way that we can overcome that?
That's a great question. And it's something that I've been in lots of conversations about over the last couple of years. So as child welfare systems across the country and here in New Jersey seek to change ourselves into systems that are deeply invested in helping families to stay strong and start to reduce any circumstance in which even an investigation, let alone foster care placement, might become necessary. As we seek to redefine ourselves that way, it's not the case that the community accepts that new definition automatically, So systems, we have earned the reputation that we have now over the course of many, many decades. And all of the actions that took place in those decades in communities across, in our case, the state, but nationally across the country. And it will take time for us to earn a different reputation. It will take some time for that to happen. I think that's going to take it's going to require our community members to have experiences with us that are really different than what they used to have. And that creates a little bit of it's not a tension exactly, but it's challenging because the actor, so to speak, in child protection investigations in our state is a DCF staff member, and the actor in the prevention space is generally not. It's one of the nonprofits that we fund. And so if you're a constituent of the state and you derive a lot of benefit, let's say from your Family Success Center or your home visitor, you don't necessarily know that that's a DCF service, you know? So it's hard for us to earn a different reputation because the action steps are different. In one case, it's our staff person doing the acting on the child protection end. And on the other end, we're funding services and we're overseeing and managing a network of services, but we don't get we're not sort of labeled in a way that's attached to that.
Yeah.
Now, there's some discussion, not necessarily in New Jersey, but I've been in discussions in other national conversations or other parts of the country about, well, do we need to make sure people understand that that's the child welfare system's service? And a lot of times when that happens, just what you said is what is the result. People avoid that service because it's known that that's attached to whatever that jurisdiction's child protection system is. So, you know, I think we will need to be humble as child welfare systems and put the families first and make sure that we're structuring services that we deliver in ways that mean they're going to be acceptable to the families that live here. Lots of families are afraid to fill out forms. Lots of families are terrified of government interaction, maybe because of experiences that they had in their home country, in the case of families who have recently immigrated here, you know, or other reasons, but maybe because of previous interactions with the child protection system itself. If we know that, then we need to make sure that we have constructed the prevention services in a way that's respectful of that history and that context. And getting our name on it or off of it, to me, is not that important. What's the most important? That people are getting the help that they need when they need it, or the support that they need when they need it, in a way that's comfortable for them. That's the thing that we need to keep, you know, our eye on.
Sure.
I think a lot of systems, and we here in New Jersey, are also thinking about our need to apologize. We need to be pretty straightforward about what the impact was of child protection policies and the way that the system operated in the past. And when we think about the war on drugs and the mass incarceration of people associated with that, the other thing that happened, it wasn't just mass incarceration, it was mass foster care placement too. And we need to say that out loud, and we need to be able to apologize for it, because those public policies together harmed families for generations. And that's not to say that that individual workers were ill-intended, you know, or anything like that. It's just that those were not the right way to respond to an epidemic of substance use disorder. That was not the humane way to respond, and yet that's what we did as a field. And so the ramifications of that through generations are still with us, and we have to face that head on and unflinchingly apologize,
Yeah.
and look to deploy what we know better now. And we need to do that better now.
Yeah, I think it's reconciling our intention and our actions now. But also, I agree with you. It's about understanding that, you know, as we know better, we do better. It's the Maya Angelou quote. I almost want to get a tattoo of that at this point, just because it has come up so many times that in a system of transformation, like, you know, we're in this, you know, transformative space right now. As you learn more about, you know, the impact of policies, you start to pivot to more humane and more successful strategies to support the entire family. So I think that's a good point to make on that. Going back to Family First Act and wondering what the next steps are in our application process, and do we have sort of an idea of the timeline by which we might hear back from the federal government?
So the plan is under review by our regional office, and I don't know very much about the ins and outs of the federal review process, but I'm sure it's multi-layered.
Mhm.
Um, we'll be in dialogue with them. They may ask us to change certain parts of the plan, or not. We'll see. Um, I am hopeful that we'll be able to negotiate to a plan that they can approve within the next, 6 months at the outside. That's a hope.
Okay.
It's really dependent on them more than it is on us necessarily. But that seems to be a reasonable estimate based on what we've observed of other jurisdictions' experiences.
Great. Lastly, I just want to ask you, what are some of your hopes for the future of child welfare practice as a result of the Family First Act? Where are some of the areas? Because I know we had already talked a little bit about some of the practices in place within the child welfare system right now that are prevention oriented here in New Jersey. But I'm wondering, where can we go with this? Where are we pushing into as sort of like the frontier of child abuse prevention?
Yeah. Um, a couple things I would say in response to that. One thing that's important to note is that states can amend their family first plans. So we're submitting this one, and then I would expect that this is a live plan.
Mm.
And as more needs show up, or as we think of other ways that families could be helped through this financing mechanism, that we have an opening to put those together and propose them to the federal government. So that it should evolve over time. And a lot of states are on their second or third amendments to their plans at this point. So that's great. That's working. You know, it wouldn't be sound policy to think that we nailed it all in one go and that's it. So it's good that can be done. The next thing I would say is that because we have already had so much rich investment in prevention in this state, and we have the children's system of care that provides really good access to families to a myriad of clinical supports, there was less for us to load into our Family First plan in New Jersey than there might be in other states that are just getting started on that kind of pathway. So some states don't have mobile response. Some states don't have care management, for example, or intensive and community treatment services. We have those in our children's system of care, so we're not going to write them into the Family First plan. So there's a little bit less in our plan than there might be in other states for that reason, because so much has already been built. I think what our plan, once we are building the services that are named in that plan, what it's going to do in the first instance, I think, is reduce instances of repeat involvement with the child protection system. So it should reduce the frequency with which we've encountered a family, we've offered some help to them, things look better, and then 6 months later, we're back with them again. That type of phenomenon should be reduced. And really, any kind of repeat entry into foster care should also be reduced. The types of services that you're able to take advantage of in the Family First plan have to fall into one of three categories. The feds will do some financial participation in parenting education, in mental health services, and substance use disorder services. Those are the three buckets. So it's not wide open. It's one of those three. Then it needs to be an evidence-based modality for one of those three things.
Sure.
So we have gone in our plan to look for ways that we can infuse evidence-based clinical practices primarily into service lines that we may already have, but don't use the evidence-based modality today. And so we're looking to take the kind of interventions that we use, like family preservation services, for example, and layer in an evidence-based motivational interviewing practice into that. That will strengthen that service. That will make it more goal-oriented for families. And we think that's going to help more families to I don't say grapple with, but to work through some of the challenges that are before them in a way that has more kind of permanent, longer lasting change, for that family. That would be the hope.
Yeah. Well, thank you. Thank you so much for taking the time to be here. Thank you for your efforts in this space, because I do think that, as a result of the work happening through the Family First Act, New Jersey, I'm partial, but I do believe that New Jersey was a leader in this space before, and I think that we're going to be able to further enhance our systems and our services, especially through layering in some other evidence-based supports into existing programs. So thank you so much for leading the way for our system.
Yeah, thank you.
Like I said at the top of the episode, whether it's upstream prevention or compassionate protection, it's all connected. On behalf of my producers in the Office of Communications and Public Affairs here at DCF, this is Jason Bukowski signing off. Tune in later this month for more DCF on the Air.